This is Larry Green, dermatologist in the Washington, D.C. area. I am, as you know, I'm very passionate advocate for our profession. I think it's very important people get involved. And we've talked about advocacy in all sorts of different facets so far. We've talked about advocacy in a federal level, advocacy on a state level. We've talked about advocacy from every different level you can think of, except what we're going to talk about today. And we're going to talk about how to be an effective advocate for the community. So that's what I'm going to spend the next few minutes talking about to you guys. And I think in a way, all the things we've talked about, being an advocate, for yourself in different ways is important. And we also talked about clinical trials and an advocate in clinical trials. I think that's important, but being an advocate for the community is very important from a personal growth point, I think. It's getting involved in your own life, not just your professional life. This is where the professional and the personal life can sometimes merge. And I think it's a great way to grow, and we'll talk all about that. So I first want to thank Equa Marketing, the leaders in digital marketing for dermatologists, for sponsoring this water cooler. And people can always ask questions and send emails, and I'll give you that email at the end if you have any questions about this podcast. So we definitely want every question to be answered, and you guys to get the most of this that you can, out of this that you can. So, and I'm certainly, I'm just one person, not perfect, and by any means, not even close. This is just all my thoughts, and I'd love to hear your thoughts, because only together can we grow and learn from each other. Can't learn by being yourself, that's for sure. By sitting by yourself. You have to have other people around you. That's the best way to grow and learn. I think that's the best way to be an advocate too. And we've talked about this over this podcast series, that being an advocate means never doing something yourself necessarily. An advocate is part of a group. It's part of doing something together. It's a social interaction. And what we're talking about today, being an effective advocate for the community, is, of course, even more so a social interaction. It's a team sport, I guess, is another way of looking at it. Advocacy is a team sport. It's not an individual sport. Individuals don't get recognized as advocates. It's doing things together that gets things done and makes change happen. So let's talk about being an effective advocate for the community. What does that mean? I mean, there are many different communities that we can talk about. I mentioned community on a personal level, and I mentioned community, being in a community on a physician level or a professional level. And then, like I said, they merge. So let me sort of break it down and give you the idea of what I'm going to talk about over the next 45 minutes or so. Is I'm going to sort of break it down into different types of communities I think we can get involved in. I'm going to spend the most amount of time, because we're doctors, talking about the physician community, the doctor community, and the different types of doctor communities that we can get involved with, and get involved in being an effective advocate for the doctor community. Then there's religious communities. We're all, even if we're not involved in religion, there's some sort of religion in our lives in some way. And physicians, I think should be involved in religion, whatever religion means to you and your family, but it's part of the community. It's getting involved in the community, and it's learning about the community and the community learning about you. I think it's important we can talk about getting involved in city organizations, municipality organizations, how that's important for a physician in order to be an advocate for the community. We can talk about, we'll spend a few minutes talking about our dermatologist community and how to be more an effective advocate. We talked about doing that, like I said before, on a federal level and a state level. Those podcasts are done. And we talked about an advocate in clinical trials, but I mean in more on a charitable giving advocacy level, because that's very important. That's where I'm talking about this whole podcast is more about, it's not just about professional growth, it's a lot about personal growth. And of course, in the schools, we can talk about that, briefly, getting involved in the schools your children are in, or were in, or will be in. That's always a great community involvement. And I'm open to your suggestions too, for those listening to the podcast afterwards. What did I miss? What other types of ways can we be an effective advocate for the community? These are things I thought of briefly when I was preparing for the podcast, but of course there are probably things I'm missing, and I look forward to hearing from your comments on this. So let's start. Let's start about getting involved in the physician community, how to be an effective advocate for the physician community. And that's just like everything else on many levels. There's different types of physician communities. And our level of involvement really depends on where we are in life, and this is really for anything that we do. And from anything from this podcast to previous podcasts, when we're busy with family and young children, it's difficult to get involved, but it's important to get involved on whatever levels are available to you to get involved, whatever is most important to you. But although it's difficult, especially with young families and young babies, we build. We start where we want and we build. And it always takes years to build to be an effective advocate for the community on any level, anything we've done for clinical research, for federal levels, for state level, for local county levels. It takes years to build. Nothing happens overnight. And like I said, it's always done together. And this is always done together. That's what getting involved is about, is being part of something that's where the sum hopefully is better than its parts, the individual parts. So let's talk again about physician communities. What's the first level of involvement? Well, we can get involved in our local hospitals, our local hospital organizations. Now, this is something we dermatologists don't generally do, but many of us are at academic teaching hospitals, or even if we're at community hospitals, we're involved in doing consults and involved in we can be involved in the hospital committees. I think it's a great way to be an advocate for the community, because in places like that, the derm voice is really rarely heard. University hospitals, what do they want? Dermatologists are last thought. In community hospitals, even less of a thought, an afterthought. So it's something that's important to you, and something that is part of your life. You're near a community hospital, or you work in an academic center. Get involved. Get involved in committees. They have a lot of committees. These places are always looking for committee members. And then you'll hopefully, with time, you can chair a committee and move up to the board of directors of that organization. It takes time. Like I said, it takes years. But it starts with getting involved. And the hospital community, or the academic hospital community, is very much a part of us, dermatologists. It can be very much a part of what we want to do. And you can't be an advocate without being involved. So make your voice heard. Pick, if you want to decide on a hospital, whether it be academic or community hospital, get involved in the community. In committee work. Committee work where voice of a dermatologist will be very, very helpful. If skin cancer is important in your life, or you deal with a lot of melanoma, the communities relating to cancer they'd love to have a dermatologist's voice, someone who treats a lot of melanoma. They don't know much about our cutaneous surgery. They don't necessarily even know that we do skin cancer surgery. It's amazing. And according to Medicare data, dermatologists do, I think, over 75% of skin cancer surgeries in the country. But there are so many physicians out there and people who don't think of dermatologists as a primary caregiver to remove a skin cancer. They'll still send to a general surgeon or a plastic surgeon. And those aren't the people who are skilled. Why? Because we're not there. We're not on hospital committees necessarily. We're not involved in hospitals. We're not involved in academic teaching centers on that level. Making our voices heard and being part of communities would help that. It takes a long way so that the educated, so people who don't know can be educated. Medicare data shows it, but people don't necessarily know it just because Medicare data shows how much skin cancer we really treat. The person that we treat by far and large the majority of skin cancer in the United States. Okay, so what else can we do? We have local dermatology organizations. Here in Washington, D.C., we have the Washington, D.C. Dermatology Society. It meets 6 or 7 times a year, maybe even 8 times a year. I can't count. in the evening or on the weekend. It varies, rotates from in various locations around the Washington, D.C. area, various hospitals. It's a great way to get out and meet dermatologists in the area. So we'll get known in the area. And these organizations, DC Derm Society, being part of the American Academy of Dermatology, there's local organizations that work with the AAD. They all work with the AAD, but that's a way to get involved in the American Academy of Dermatology. For example, we in the DC Dermatology Society, we're allowed to send someone to the AAD advisory board. We have a representative. And that representative reports about everything. I just got an email from the representative today, our DC Derm representative, reports everything that the advisory board is doing and doing with the American Academy of Dermatology board of directors as well, and what's going on, what are the issues we're facing, and what are things that are being done about it. But if I'm not part of DC Derm Society, I'm not going to the meetings, I'm not going to know this. I can't be an effective advocate. I'm out on an island. And they're great camaraderie events. You get to meet with your fellow dermatologists. You'll learn something. There's usually education involved, almost always education involved. And you're becoming involved with our local dermatologist community. And these local dermatology societies often lead into state dermatology societies. There can be city dermatology societies, but also state. Washington, D.C. is unique in that it's really a city and a state, but so the city is the state. But in other states, you can have, say, a Tucson Dermatology Society that goes with Arizona Dermatology Society. It's part of Arizona Derm, etc. So being linked with the city will get you linked with the state. Both are linked to the American Academy of Dermatology. We're all in it together. It's being there on the local level does not make you, it does make you an effective advocate. Just because you're not there, the AAD advisory board, or you're not there at the Arizona dermatology meeting, so you're just at the Tucson dermatology meeting, does not mean you're not involved. You are involved. You're learning. You're working with your colleagues. You're seeing what is going on in the dermatology world. So if something interests you, you can move on to the next level. People who have been in DC Dermatology Society for a while and they take up the position of officers, go on to do a lot of really bigger and better things as advocates for our specialty. So please get involved in your local and state medical societies. I was just at a state medical society meeting, and I live in Maryland, even though I'm part of it's confusing because DC is really District of Columbia, Maryland, Virginia, DMV. But I'm also part of the Maryland Derm Society because I do live in Maryland, but it's far away. I do most of my stuff with DC Derm. But I recently spent some time with the Maryland Dermatology Society president. She came to the state medical society meeting at the House of Delegates and made her voice heard. It was great to see her there. She's getting involved. She's representing dermatology. And she started by being part of dermatology and being an advocate for the community, just on the state level. And now she's an advocate for all of medicine. So every little bit, and it takes time, but every little bit builds. So let's talk about the local and state medical societies. Another way of getting involved. That's great. A lot of people think, why do we need a county or a state medical society? We have the American Academy of Dermatology. We have our state dermatology society. So why do we need the community of physicians at large? I think for the same reason. Well, one of the same reasons is for the same reason that if you're involved with a hospital, whether it's an academic or community hospital, that you join a committee there and get involved. Dermatologists are not the first people thought of. We're 1% of medicine, and we're not always thought of, we're in a way an afterthought for other doctors. They don't even know, like I said, we are the primary removers of skin cancer in the United States. But they don't know because they don't see us. We need to be visible. We should join our local county and state medical societies. And that's why I so much appreciated that the the State Dermatology Society president of Maryland took off her Sunday, and she has young children, to be at the State Medical Society House of Delegates to make sure the dermatologist's voice was heard as the State Medical Society debated their issues, the Maryland State Medical Society, is so important. And again, that's part of being an effective advocate for our doctors community, our dermatologist community on a local level. We're part of the House of Medicine. And the truth is, we can't get much done, at least in Maryland here, I can't get much done without the backing of my state medical society. And the State Dermatology Society people know it. We're too small apart. The state legislature or the local legislatures are not going to listen to us alone. They listen to the House of Medicine. Things really get done when you're part of the House of Medicine. And that things don't rarely get done as dermatologists. Even, for example, something that's an issue for us as dermatologists, like tanning. And I may have talked about this in previous podcasts, but it's important for us to educate the public on how dangerous indoor tanning beds are, especially for minors. And it's part of the AD model bills, and then the ASDS model has an excellent model bill about using sunscreen in schools. The AD being able to apply, kids being able to apply sunscreen in schools. The AD has model bills about not allowing minors to tan. In other words, you have to be 18 to use a tanning box. You have to be an adult. Tanning machine because they're so dangerous. That's our issue. It's not surgery's issue or internal medicine's issue or ENT's issue. That's our issue. Why should that take precedence over what ENTs or anesthesiologists or ophthalmologists are going through? But you know what? It's an important issue. It's a great public education issue, and we have to make that known. We're not going to make that known. We can't do that on our own. We have to make that known through the state. And so the State Dermatology Society in Maryland received a grant from the American Academy of Dermatology. You could say state derm societies can apply for an AAD grant. It's a whole grant process. And the request in the grant was to help create an underage ban on indoor tanning machines. But the State Derm Society didn't do it alone. You know, had a grant from the American Academy of Dermatology. The Maryland State Derm Society looked to the state medical society's help for their help. They put a resolution out, and that's what happens when dermatologists attend State Medical Society House of Delegates and get involved in the State Medical Society. We can get our issues can become their issues. If we submit a resolution, and this is the way it works in Maryland, I assume it's similar in other states because it's the way it works in the AMA and similar organizations. We submit a resolution asking for the State Medical Society to make it their policy to develop legislation and pass legislation so that minors shouldn't be able to use tanning beds. Okay, that passed. So our white hat issue is now the whole State Medical Society's white hat issue. And again, state legislatures aren't going to listen. We've talked about this in previous podcasts. State legislatures aren't going to listen. They're not going to listen to our local dermatology society. They'll listen to the whole state. The whole state, all the doctors speak together. We're not that big. Doctors are a small part of what the state legislators hear, but they'll listen to us on doctor issues, especially if we're united. Especially if we're united. And now it became law in the state of Maryland just this past April or it's going to become law, I should say. It went to the governor's desk, was passed in the state legislature, that children under the age of 18 cannot use a tanning bed, period. You have to be an adult. It wouldn't have been done without people, dermatologists, being advocates at our local dermatology organization or our state dermatology society working with the state medical society. So let me talk about, and it's a good segue to getting involved in local and state medical societies. You don't have to do it as part of the dermatologist organization. I think that's a great way to do it, but you can do it on your own. Just like you're on your own, part of the hospital community as a dermatologist, representing dermatology. I've been on my local county medical society for very many years. I've been on the board. This year I was promoted to be president of the county medical society for a year. But that means dermatologists are now at the forefront of what's going on in the County Medical Society. My issues are, no, I'm not going to represent just dermatology. There's no, as a County Medical Society president, I represent all of medicine. But it's more recognition for dermatologists. Our County Medical Society has brought dermatologist issues, and especially involving the high costs of rising costs of medications, step therapy issues. We've put through resolutions for the State Medical Society with the help of the Maryland Derm Society, because they're on our side, because they're dermatologists. But I'm a dermatologist submitting this through my County Medical Society, which represents all doctors. These issues have become state issues. And the whole society of medicine, all of medicine is now behind it. Behind step therapy, behind the rising costs of medications that our patients have to pay. These are issues that every physician is facing, but dermatologists, it's really important to us. It's really been affecting us, and we've brought it to the forefront. People see, when dermatologists are participating, people can see what we are and what we do. That's how to be an effective advocate for the doctor community. So participate, get known. You always start by joining committees. So important to join committees, because you can't start by being on the board. And going to meetings. Actually, you have to start by going to meetings. You have to find out where the meetings are. Where's your next local county medical society meeting, your state medical society meeting? I go to Baltimore. It's a pain. It's an hour, 1 to 2 hour drive, depending on traffic, on Monday evenings in January and February, because that's when the Maryland State Medical Society Legislative Committee meets, where every bill that affects doctors is seen and heard, and it's based on the positions and resolutions that the State Medical Society has passed, but the State Medical Society takes a position and will help support or not support legislation. That's important. It's important to have dermatologist input there. A lot of what happens to us is really on the state, much more than the federal level. A lot of how we practice medicine. We're licensed by the state, and I mentioned this in previous podcasts, but it really, getting involved in the state level is easier than the federal level, because there's so many less people doing it, so many less people even want to try and do it. It's easier to make a difference, but we still have to make a difference as part of the whole house of medicine. Dermatologists, being an effective advocate as a dermatologist means getting involved in the Society of Medicine. And the American Medical Association is very important also, but it's more a federal thing. I think it's just as important, if not more important, to be involved on a state level, because we're licensed to practice medicine by the state. The way we practice is determined by the state, much less than the federal government. And it's easy to get involved. So I would urge everyone listening to this podcast, in order to be an effective advocate for the community, I know we're busy, and many of us have young children. And I'm not saying spend less time with your children. That's so important. But go for it. Go start with becoming part of your dermatology society, your local or state medical society, your local or state dermatology society. Join a committee, one committee. Over years, as your kids get older, you can move up to hopefully becoming on the board of directors, maybe even on an executive board, president, vice president, secretary, treasurer, and your voice will be heard. It's not built in a day. It's built over years, if not decade or plus time. But you got to start. It doesn't happen right away. You got to slowly build, so you take time. It's not joining millions of committees at once. Start small, depending how much time you have, and go from there. Okay, so that's, I think, how we can become advocates and network through as physicians, more specifically as dermatologists, with other physicians. It really is all about networking. And that's what advocacy is about, networking, because you can't advocate if you don't know someone or work with someone who knows someone. And that's why groups are so important. It's a group sport, team sport. So it's all about networking. Let's move away from being dermatologists working with other physicians to being dermatologists in our communities. I mean, that's a community of doctors. Remember I mentioned that's the first community, and then all different types of communities. Let's move on to the non-doctor community. how do we fit into the non-doctor community? How can we make a difference? How can we be effective advocates for the non-doctor community? I mentioned religious organizations. I think that is a great way to get involved. And religious organizations vary. There are organizations that are not religious. You don't have. I'm not talking about being a devout Christian organization or Muslim or Jewish. It doesn't have to be that. It's where you are in your life and what you want. There are quote. You can put religion in quotes, but there are organizations that have members and where there's networking with members, and it's where you feel comfortable. But no one's going to know what a dermatologist does if you're not there working within that religious, whatever, and I'll put religious in quotes again, group. They're not going to know you. You're not part. That's a community to get known. And again, your level of involvement will vary. You start with their committees, and you can move up to the board of directors or executive board over years. But being part of this is personal growth, I think, and this is where we start. And not to say that being in doctors' organizations is not personal growth. That's personal / professional networking and growth. But networking on a local community level is, I think, strictly personal growth. We only live once, and you never want to look back and say, "What if I should have done this?" I mean, I guess that can always happen. But always take advantage of opportunities and always try and create opportunities, I think. And you can't create opportunities unless you open yourself up to opportunities. And that's getting involved. We live on this planet with all these other wonderful people in this world. There's a lot of non-wonderful people. We don't have a great time, in my opinion. Right now, the world is not such a great place. But there are wonderful people in this world nevertheless. And there's no other way to get to know them unless you're out there in the community. You can't sit in your office and meet the world. The world does come to us in the office, but we need to go out and meet the world as well. I've met so many people in my office who come in as physicians that I really enjoy spending time with them, talking with them. I think that's one of the best parts about being a physician, is meeting the nice people who come to the office to see you. But you also have to get out there. And besides the doctor community, we need to get into the community of non-physicians. And I think religious, and again, I'll put that in quotes, organizations are a great way to get involved. Doctors, I don't think doctors are held in as high esteem as they used to be professionally, but I still think, especially when it comes to these organizations, we still are, and especially religious organizations. A doctor is still a doctor, and our thoughts are heard. We're still thought of as educated people whose thoughts are important and need to be heard. So be very involved. And all these personal, professional growth things, all these local organizations we're going to talk about in the next few minutes, they're waiting for us. It's not hard. It's not going to be hard to seek them out. They certainly want us. They just want us to be involved. So I'd encourage people to get involved in your religious, and I'll put religious in quotes, community, depending on what your religious leanings are. And you can be involved in multiple religious organizations, and again, I'll put religious in quotes if you want, because we can't be an effective advocate unless we're out there. And people need to know what we do. They're not going to know what we do and what we can offer without us networking within them in our thoughts. You know, people in the religious community, church, may not know what a dermatologist does, the things that we can do, unless you're there. I'm not saying we advocate for ourselves and talk about all we talk about is what we do. No, we're there for them. Just like we're there for the doctor organization. We're dermatologists for the State Medical Society. I represent the State Medical Society and all the needs of doctors. When you're in a religious organization, of course, we're there as dermatologists. When we're there, we represent that religious organization. We're there for that religious organization's needs. And that's the way it should be. But by networking and working with these people and being there for them, they'll be there for us. They'll learn about us. It's the only way, I think. And that's a way to get our name out in the community. Another organization that I think is a good idea to get involved with is a local chamber of commerce. Lots of small businesses get involved in the local chambers of commerce. In my area, there's a city chamber of commerce, and they meet once a month, and it's a great networking event. People can network all the time. People will learn about what you are, what you do. You'll learn about what they are, what they do, services they offer. It's a fantastic way for small businesses to get to know each other. Networking is very important in your local chamber of commerce. That's basically what it does. And then you are also, when you're at a chamber of commerce meeting, you're a spokesman for the chamber of commerce. If you're involved in committees there, which is great to get involved with, you work for that organization. But again, when you do that, it's a repeating theme, they learn about you. They learn about what dermatologists can offer. I'm not saying we go out there and say, hey, I'm a dermatologist, local chamber of commerce. I offer botulinum toxin and skin cancer surgery, and no one else can do it better. That's not what we do. I mean, that may come up in conversation with time, not right away, but first and foremost, you're there for the Chamber of Commerce and the community. And you're there for the community's needs to discuss what's going on in the community. And with that, you'll really know what's going on in the community. I mean, you'll really be up and up on what shopping mall is being built. I don't know, whatever's going on in the community, which is important because your lives and the lives of our children are, very much affected by what's going on in the community. Let's talk about other types of communities I thought of about getting involved with, about being an effective advocate. How about our schools? Our children's schools. Our children are so important to us that the schools they go to, whether it's public, private, no matter what it is, whether it's a elementary school, middle school, high school, university, college, we're the parents. We want to know what's going on. And how do you know what's going on from your children? Yes, they can tell you, but to be part of the school is to get involved with the school. There's PTOs, parent-teacher organizations, but there's many other parent communities, and there's school boards. But schools have committees for different events that the school does as well, besides PTO. There's a lot to do in schools. And again, all these things are getting involved can take up a lot of time. I'm not saying pick them all, pick and choose. I'm just throwing out ideas. But the schools don't know what dermatologists have to offer, treating acne, treating psoriasis, molluscum. They may want to just go to the pediatrician for those things. They don't think about a dermatologist. But if the dermatologist is there, again, not saying that we're out there throwing out our business cards, come see me if you're when you have acne as a teen. No, you're in the community. People talk, you're networking. You're involved in the PTO. You're there to help the kids on their field day. You're on that committee, field day committee, whatever committee the schools have. It's important. You'll talk to other parents. The children will see you. You'll get involved. I mean, I can't think of a better way in that respect of getting involved with the schools. Schools are, in a way, our lives. And you can't be an advocate for the schools without being involved on committees. You can't just show up at a parent meeting and lash out against the school principal. You're not going to get anywhere. And dermatologists won't have a good name. We want to be part of the community, not just the physician community, not just the doctor community. We want to be part of the community. And our schools are a great way first start. So those are the things I thought of on a local level. I'm sure there's more, and I welcome your ideas and input. But I talked about the religious community, the Chamber of Commerce, talked about getting involved in our schools. There's one more thing I want to spend a few minutes talking about before we summarize and wrap up that I think is a very important thing to get involved in as physicians. So our heads are not seen as being stuck in the sand, only just worried about ourselves and our livelihood. I can't think of being an advocate for the community without being involved in a charitable organization in your community. or multiple charitable organizations. There's doctor charitable organizations, which we'll talk about, and then there's non-doctor charitable organizations. But being part of a charity and a 501c3 organization is so important about being an effective advocate for the community. Because, first of all, it's part of personal growth. I keep talking about personal growth, but getting involved in the Chamber of Commerce and religious communities, personal growth. Getting involved in schools, personal growth. But getting involved in a charity, it's all about personal growth. I mean, this is, again, we only live once. There's so many worthwhile charities. You can't do them all. You have to pick and choose. There's no doubt. But pick and choose your charity and get involved in some charitable work. Volunteer. It can be, and it can cross-reference with professional growth. It can be free skin cancer screenings. It can be giving out sunscreen, samples, but to charities. For example, a charity walk. Why not get some free samples? All the free samples we have in our office. Spend the morning and afternoon with that charity. The people are walking for that charity. Make sure they got sun protection. Be out there to give them sun protection. It's just a simple idea, but be out there and get involved. Let me talk about some of the dermatology-related charities that I think are great to get involved in, and then we'll talk about non-dermatology charities. That's really up to you to find. You have to find the charitable organization you want to be involved in. There are thousands of them, but let me just mention some of the good dermatology charities to be involved in. The American Academy of Dermatology, of course, has charities. And the ASDS has charities, the American Society for Dermatologic Surgery, that are, and I'm sure all the dermatology organizations have as well. Those are the two I know best. They're involved in research. The ASDS is a research fund, a patient education fund. The AAD has similar funds. They have a research fund. The AAD, of course, has Camp Discovery. Every dermatologist I know who's gone to Camp Discovery has said it's so much personal growth comes out of it. Camp Discovery is the American Academy of Dermatology's camp that they have every summer, and it exists based on our charitable donations for children with skin disorders, chronic skin disorders that can't have a normal life because in their schools they're treated as lepers. Here at Camp Discovery, they're just like everyone else. They're part of the crowd. They're not someone who stands out and is automatically looked upon. They're like everyone else. Camp Discovery is a great charity to donate to. We have the Skin Cancer Foundation, another research organization. We have the Dermatology Foundation, another research organization. But getting involved in these charities is in a way becoming an effective advocate for our dermatologist community. Because money talks. I mean, with a donation to those organizations, you'll get known. Your name gets out there. It's on lists. People see your name. And when people see your name, they'll know that you're out there, you're trying. You're trying to help what dermatologists do. You're trying to help, if you're a Camp Discovery donor, what these kids who have all these, whether it be severe psoriasis or blistering disorder like epidermolysis bullosa, whatever they have, you're donating to that. It says a lot. You don't have to necessarily give money. Like I said, I know a lot of dermatologists spend part of the summer there. They bring their own families. Couldn't think of anything better to do and to show your kids and to teach your kids. What a great way to get involved. So that's getting involved in charities by giving money and by giving your time. I think both will give you personal growth, and both are great networking activities. And then there are dermatology organizations that are not directly tied to the AD or ASDS, or these research like Derm Foundation or Skin Cancer Foundation. They're just funding research and stuff like that. There's the National Psoriasis Foundation, for example. What a difference the National Psoriasis Foundation has made to people. I've been very involved with the National Psoriasis Foundation probably for 20, 25 years now, since I was a dermatology resident, even before that. What a great organization that exists to help people with psoriasis, whether it be with helping them get their medicines, helping them get diagnosed, helping them feel better, helping them with finding therapy, helping helping them with advocacy to make sure they can get their medicines better, and helping with research to find a cure. That's a wonderful organization and very easy to get involved with on a local level. I just went, for example, this past weekend, my local National Psoriasis Foundation, they have community managers in most communities in the country, and we had our Washington, D.C. annual fundraiser for psoriasis. It was a bingo tournament. Every dermatologist in the area is invited, and not that many went. I wish more went. But it was just an evening, a bingo charity event evening. It was really nice. It was elegant. Food was good. A lot of people with psoriasis came out to help support the cause, or people who know a loved one with psoriasis came out to support the cause. Great chance to network. But here we are as dermatologists treating psoriasis. How can we not support an organization that is dedicated to helping people with psoriasis? Cardiologists aren't going to go. They may go. That'd be great if they go. But they have their own organizations, charitable organizations, to help. But we as dermatologists, want to be an effective advocate for the community, advocate for our own patients on a local level. So I was honored to be there. It was fun. A great way to meet a lot of people. A wonderful evening, and we raised a good amount of money. And this is done on a local level in communities throughout the country. Sometimes it's a walk. Here in DC, we have a bingo event, but many other communities have a walk for the cure for psoriasis. There's not if you don't see much psoriasis, there's the International Hyperhidrosis Society. There's other organizations that are advocates for patients with conditions like that, whatever they're advocating for, charitable organizations. So not directly related to the American Academy of Dermatology or the SDS or the Mohs College. Again, they have their own, or the Derm Foundation. Those are all important organizations, but being an effective advocate for psoriasis is important if you see people with psoriasis, and it gets you involved in the community. So that's the other thing I thought of is charities, being an effective advocate for the community. So I guess I'll summarize and then open up to questions, and I'll give you guys an email if you're listening to this on archived, to email questions and comments and stuff like that at the end. But we talked about how to be an effective advocate for the community. And I started by saying how important it is on a local level to get involved. We can get involved with our doctor organizations, our dermatology organizations, our general doctor organizations. It's important to network, not getting involved in all these things. We talked about a lot of different things. We talked about county medical societies, county derm societies, or city derm societies, state derm societies, state medical societies, hospitals, community and academic hospitals. So many ways for dermatologists to get themselves out there in the world. And an academic hospital is still a community, as much as a community hospital is. So when you're there, you're getting involved, you're an advocate for that community, and they learn about dermatology. We are part of the world of physicians. We're not out there on an island, and they need to know about us, because a lot of other physicians think we're out there on an island, and all we're interested in is making money on botulinum toxin, or we just see patients with acne and treat warts. We don't do skin cancer. So much that other doctors need to learn about us. So that's getting involved in the doctor communities. We talked about getting involved on a local level in the non-doctor community, getting involved in your religious organizations, being on committees for that, getting the word of, what dermatologists can do when you network, the word will come out, getting involved in your chamber of commerce, getting involved in schools. So important to get involved in what our children are doing and get involved in that school. Because, again, no one wants to hear a parent who's never been around who asks a question about why isn't this being done, or how we could do this better. But they want to hear from a parent who's been around and has been helping out as much as they can, especially, a dermatologist parent who's been helping out, because they're going to learn about dermatology as well. They're going to ask what you do. When you're there for them, they'll be there for you. And then we talked about getting involved in charitable organizations. We have so many dermatology-related charities. which help with research and dermatology things. And we have Camp Discovery, Great American Academy of Dermatology, charitable organization for children with skin disease. We talk about organizations like the National Psoriasis Foundation, which I think is a great charity, which is there just dedicated to helping find a cure for psoriasis, helping advocate for people with psoriasis so medicines don't cost so much. You can call the National Psoriasis Foundation if you're depressed with your psoriasis, if you don't know which medicine is best for you. They have someone 24/7. They have someone during the day to help you, whether it's emails or live phone conversation. Of course, these charitable organizations need money to do all that. They need money to support that. They help our patients so much. Why shouldn't we help them? And I want to thank Echo Marketing, who, again, for sponsoring this. They've been great hosts. Can't thank them enough. They're the leaders in digital marketing for dermatologists. They want us to succeed, and they want to try and help us succeed. With that, I'll close. Thank you much, and I'll open up to any questions you have in the audience, but also feel free to email us your feedback and your questions, and we'll go from there. Glad to answer, and thank you very much. And lastly, we look forward to starting another water cooler series sometime soon, and you're participating in that, and welcome your feedback and ideas for other water cooler series to help us dermatologists be better dermatologists and better community members. So thank you again.